Hi, I'm Dr. David Scheiderer, Director of Education at Integrative Psychiatry, headquartered in Sarasota, Florida. On behalf of our President, Valerie Belandra, and the rest of our excellent staff, I'd like to welcome you to this, our inaugural installment of what we hope will be many, in an effort to help educate you as to our philosophy regarding the state of the art and science of psychiatric diagnosis and treatment. I have here with me today in the office one of my patients. I will call her Beverly, largely because that's her name. She does not want to be in this video, and I'm not going to make her, and that's the kind of guy I am. But I would like to use her story as an illustration of just where we are here in the United States with respect to treating mental illness. Beverly, thank you for being here with us today. And I know I owe you big time. Beverly's story, unfortunately, is not unique. She has suffered from depression and anxiety for decades. And while she's very high functioning overall, she's a mother and she works outside of the home, and she carries a lot of freight, right? She's happily married, well, most days, right? Okay. And that's good for any of us, I suspect. That said, she has suffered from residual symptoms throughout the years, often leaving her miserable, but also dysfunctional in numerous spheres in her life, scholastically, occupationally, interpersonally. And the tragedy of this story is not only as pertains Beverly's life, but this pretty much is what afflicts so many of us here in the United States. For example, of all people who suffer from major depression, one of our major psychiatric syndromes, only half ever even receive medical treatment to begin with. Of that half that does, about a half, maybe a little bit less, ever go on to receive adequate treatment. Meaning that of all people in any 12-month period of time that suffer from major depression here in the United States, less than 25% receive adequate treatment. So bad are the numbers, indeed, that one recent article suggested that of all people who ever suffer from major depression, only 1 in 10 receives even minimally adequate treatment. That leaves a lot of room for improvement, right? 90% of those who suffer from this very disabling, potentially disabling illness ever even receives adequate treatment. I mentioned that depression is disabling, but did you know that it is actually, in North America, the leading cause of disability ahead of all other disease states, right? Heart disease, arthritis, lung disease, as measured by disability-adjusted life years. Even if you don't buy into that study, numerous studies have always placed depression, just one of our many psychiatric syndromes, in the top 3 for disability. Moreover, however, is that depression is a degenerative illness that rots your brain. The longer you go on with depressive symptoms, the worse your brain functioning. And beyond a certain threshold, maybe we can't even get that all the way back. Hence, the urgency to relentlessly stamp out all residual forms and signs of this dreaded illness. In addition to depression being degenerative, it's also progressive, meaning the more episodes you have, the more episodes you will have. The greatest predictor, most accurate predictor of whether you will get depression in the future is how many times you've been depressed in the past. But there's more. Wait, right? And that is, we know this to be a systemic illness, such that if you suffer from major depression, you're twice as likely to get diabetes. You're much more likely to have a heart attack and die of that heart attack if you're depressed. If you're a woman over the age of 65, you're more likely to have bone mineral density loss. And of course, depression hurts, right? You're much more likely to experience aches and pains in an amplified fashion. People who suffer from major depression, on average, die between 10 to 12 years before the person who doesn't suffer from depression. Right? So the story then that's emerging, and I've already said these things to Beverly And as such, I'm not scaring her for the first time, but I use this information to help motivate my patients. Well, let's look at treatment, right? At least we have great treatments. Well, not so fast. Even though antidepressants, which are multi-billion-dollar products, annual products here in the United States, and the number 2 most commonly prescribed class of medications, second only to the statins used to treat high cholesterol in the United States. What do we get for this extensive and often appropriate use of antidepressants? Well, that would be about a 30% remission rate on a good day. Right? If you look at the data very carefully, about 1 in 3 people who suffers from major depression and gets antidepressants will actually have their symptoms go into remission. That means 2/3 do not. Well, what do you do in that situation? Now, don't get me wrong, right? We at Integrative Psychiatry, and let me just as an aside tell you how that name came about and what that really means, at least to us, and that is we integrate the best of both worlds. We integrate the best of traditional Western Orthodox psychiatric treatment, i.e. medication, psychotherapy, the usual workups. At the same time, however, because of the really poor track record for these approaches overall, we have mastered, right, or continuing to try to master different alternative and complementary approaches to the diagnosis and treatment of mental illness, of psychiatric symptomatology. This combination approach is best referred to these days either as functional medicine or functional psychiatry, or integrative, combining what we believe to be the best of all possible conceptual frameworks for helping the most individuals over time. As we wrap up, I would like to invite any of you who have or are suffering from not only depression or anxiety, but any of a number of associated symptoms such as poor sleep, poor concentration and attention, decreased energy, easy fatigability, difficulties managing your weight, interpersonal rejection sensitivity, irritability, irascibility, lability of mood, reactivity. If you suffer from binging on anything, really, food, alcohol, substances, excessive behaviors, risk-taking behaviors, we believe that our approaches might prove useful. We are particularly interested in hearing from you if you have tried traditional Western medicine approaches and if they have failed you. Now, if you want to go ahead and try our integrative or functional medicine approach to your ails, that's fine too. We will leave that up to you. At any rate, the best way to get more information about what we're about would be to visit our website, integrativepsychiatry.net. That's integrativepsychiatry.net. I'd spell it for you, but I'm not sure I could. I-N-T-E, into G-R-A-T-I-V-E, psychiatry in the usual fashion.net. Or you may call our 1-800 number and schedule a consultation, a personal consultation, either with myself or with Valerie, our fearless leader. She's smarter than I am and better looking. I think I could take her in a wrestling match, but it would be close. And please don't quote me on that. Our 1-800 number is 1-800, cleverly enough, 385-7863. That's 1-800-385-7863. I'm reading that from a piece of paper on the tripod because I haven't memorized it because I have a smartphone and I couldn't even tell you my own home phone number for that matter. All right, 1-800-385-7863. In the hopes of being able to work with you and make your life journey more rewarding, we would love to hear from you. Until then, Dr. Dave signing off, and please stay tuned for future installments. Thank you.